Inside this building in the heart of Perth, decisions are being made that could have a global impact.
And if everything else is correct, I'll get you to sign and date the bottom.
One by one, these volunteers are being screened to see if they're the right fit
72.2.
to take part in one of the world's first human trials of a vaccine for COVID-19.
So your BMI is 20.4 and it's a good BMI.
It's important to consider finding a vaccine for COVID like a war, so we need to attack it on multiple fronts.
Okay. Yeah. And how was that? Good.
No problem at all.
No problems?
Yes.
Good. Great. Thank you. It's a big day for us. We're planning on making history today.
Clinical research company Linear has been granted a rare opportunity.
It's one of those lifetime career goals to be able to contribute to such an important and exciting trial that has this global impact.
150 candidates are needed initially. Linear CEO Jaden Rogers says the entire trial has been fast-tracked.
I think everyone would agree it's being a hectic pace. We're really trying to condense what would normally take 4 to 5 years at least into 18 or 24 months.
Thank you very much. Thank you.
It's a rigorous process for everyone. The volunteers who'll be injected with the vaccine need to be fit and healthy and pass a number of medical tests.
Just got his blood results back here. His potassium looks really good.
From property managers to medical students, there's no shortage of volunteers.
Someone has to step up to do it.
Yeah.
So we might as well get involved.
Each with their own reasons for putting their body on the line.
I heard about the trial originally from just watching the news, so I thought I'd just go and sign up. I think that developing a vaccine is probably the only way that we're going to be able to going back to normal.
Rochelle Callick has never volunteered for a trial like this before, but the impact of COVID-19 has motivated her to take part.
It is personal. My dad is an Uber driver, and so he saw his source of income just dry up. So he's actually on JobKeeper at the moment. Mum's a bit concerned. She sees it's necessary. She doesn't see why I should do it. It's not just some person with a rusty needle in the back of a shed injecting live coronavirus. It's not about that. It's actually something which has very strong regulations around it.
On the day of their first injection, candidates are swabbed to make sure they don't already have COVID-19. Rochelle has made the cut.
Hello, would you like to come through?
Sure.
So has fly-in, fly-out worker Benjamin Bruce.
All right, your tissue there.
A lot worse than last time.
Oh, sorry.
They both have a series of blood tests and go over consent forms.
Without people volunteering, you could never get new medicines properly tested on people.
Yeah, a bit nervous, but excited. Yeah, curious to see what happens.
A small proportion of our participants will get a placebo arm. The investigator, the study teams, the clinic team, and the participant are not aware of whether they've received placebo or the vaccine itself.
The actual injection happens behind a screen. They're monitored to make sure there's no immediate reaction.
Just like getting your regular flu vax.
I wasn't too worried about it, but it's pretty easy. Easier than I thought.
Clover Biopharmaceuticals started working on this vaccine candidate in early January.
The vaccine being trialled by Linear is called SCB 2019 and was developed by Chinese company Clover Biopharmaceuticals. Using highly specialised technology, this synthetic vaccine closely resembles the real viral spike protein that surrounds the virus. These spike proteins are what allow COVID-19 to invade human cells.
The intention is if you are ever infected with COVID-19, your body knows exactly how to deal with it. Once they've been vaccinated and safely discharged from our unit, we ask that they measure their temperature every evening and they record that in their diary.
24 hours after receiving the vaccine, Rochelle sends her symptoms back to Lara.
I feel great. I mean, I feel fine. I feel completely normal.
"20-year-old Benjamin Bruce volunteered for the trial out of concern for the impact of COVID-19 on vulnerable Australians.
I have elderly grandparents myself, and I know they're a high-risk factor of the population, so I'd love there to be a vaccine that could protect them.
Benjamin and the others on the trial will be paid around $2,000 for their time. It's a 2-year commitment and comes with plenty of rules.
No recreational drugs, no excess drinking, no drinking before dosing. Yeah, you can't exercise too much either when you're doing the trial, so you have to limit strenuous exercise.
His first check-in shows he's doing well. According to the World Health Organization, there are now 17 vaccines that have reached the clinical evaluation stage and more than 100 that are preclinical. So, what are the chances of this particular vaccine candidate succeeding?
Plover's vaccine is similar to several others, including the one developed by the University of Queensland. I think they're very strong candidates. To be clear, the clinical trial stages for most of these is at the stage of understanding safety. So we won't be able to tell anything at the moment about their efficacy.
Infectious diseases expert at the Doherty Institute, Damien Purcell, says that the complexity of the COVID-19 virus means multiple vaccines will be needed.
I think it's actually likely that we might need more than one vaccine, and as many as we can develop is probably the right way to go at this point in time.
A week since their first jab, Rochelle and Ben and the dozens of other trial participants return for a checkup appointment.
And if you haven't had any new symptoms or medications recorded, that's really good.
Neither of them are showing any negative side effects so far. They'll receive a second dose of the vaccine 21 days after their first injection.
Okay, but generally it's quite consistent, 36.5, 36.4, and I can see you haven't really needed to record any new symptoms.
The next phase of the trial would see thousands of participants take part across the world, but everything hangs on what happens in the coming months.
Great, thank you. That's okay.
Even if this isn't the successful vaccine candidate, at least then we'll have learned something about it. It's such a momentous thing. It would make such a difference for so many people.